Good morning. My name is Bill Goolsby. I'm the founder of Epiphany Therapeutics, a company that is focused on inspired alternatives to conventional care, and we're going to talk a little bit about some of those things today. My career has been spent in the life sciences, frequently engaged in the process of drug discovery and drug development, and inflammation is at the heart of the things that have interested me in my career, and it is central to the topic that we're going to cover today. Epiphany, broadly stated, focuses on inflammatory conditions that can be treated in ways that have not been common in modern medicine. We use a bit of a slogan for our company, and we say inspired alternatives to conventional care, and we're going to talk about one of those today, one of those that has deep research and validation experience in human beings. So today's topic will be about anemia. Anemia is a condition that is very common for a variety of reasons, and it involves having hemoglobin, which is the oxygen-carrying component of red blood cells. It's when that hemoglobin drops below a given concentration in blood. Anemia has a number of side effects and consequences, the most important and the most identifiable of which is lack of energy. When the body doesn't get enough oxygen, it needs oxygen for energy. In its absence, fatigue can be profound. So, specific to anemias, we're going to talk about anemia of inflammation, which I see as being far and away the most common form of anemia. People use the description commonly iron deficiency anemia, which makes it sound like your body doesn't have enough iron in it, and therefore you need to be supplemented with iron to resolve your iron deficiency. I don't view it that way at all, and I believe that the clinical research, a great body of clinical research, demonstrates commonality in anemia of inflammation and how it's viewed and defined in different patient populations. So anemia occurs when a process called erythropoiesis is reduced in the body and iron becomes unavailable. Here is a simple definition of erythropoiesis. The kidney sends a signal based on low oxygen concentration in the blood. The signal goes ultimately to the bone marrow, where hemoglobin is produced and hemoglobin is made as a consequence. Sometimes there are conditions in the body, many of them inflammation associated, that prevent either the signal or the availability of iron to go to bone marrow to produce hemoglobin. This occurs because of a heightened inflammatory state that can occur in a lot of chronic diseases, can occur in us when we're otherwise healthy. Just an aberrant spike in one particular inflammatory protein that we call interleukin 6 interferes with the body's ability to transport iron from where it is stored in our cells to the bone marrow to make hemoglobin. Fairly simple, not complex. It's an inflammatory event that causes most anemia in modern patients. Let's talk about anemia in three different settings, three different populations. First, we'll talk about anemia during pregnancy. We'll next talk about anemia in the older aging population. And third, we'll talk about anemia in chronic disease. When we talk about anemia and chronic disease, I'm going to specifically refer to lupus, where anemia is very, very common. Pira Valenti, a professor at the University of Rome Sapienza, and her colleagues have done fantastic work over a period of many years evaluating pregnancy-associated anemia. In this slide, you see the effects of treating anemic pregnant women with purified bovine lactoferrin for 30 days on a number of hematological parameters, compared to the group at the bottom, which were treated with the standard of care, ferrous sulfate or iron supplement. What's important in the data that you're looking at is to see the increase in HB, hemoglobin, over a 30-day period of time, from nominally 10 grams to 12.5 grams. The results associated with ferrous sulfate, you can see some increase in hemoglobin. It's more modest, and it isn't durable. On the far right side of this slide, you'll see a column titled IL-6. That's interleukin 6, the inflammatory protein that I mentioned a few minutes ago. You'll see that in the bovine lactoferrin treatment arm, interleukin 6 declined. In the ferrous sulfate arm, interleukin 6 increased. That makes sense. Iron is an oxidizable substance, and that oxidation creates an inflammatory response. What was important ultimately in the work that Valenti did, however, was to demonstrate that this mechanism of reducing interleukin 6 to increase hemoglobin was applicable not only to pregnant women, but non-pregnant women, and therefore it is natural to say, and I believe all the data supports it, that it's not only women, it's women and it's men. This next slide shows the effect of treating anemic non-pregnant women for a period of 30 days, 60 days, and 90 days, again, compared to an iron supplement. And you can see that not only does hemoglobin increase, but for as long as the individual took the bovine lactoferrin, their hemoglobin stayed high. This is a fundamentally important thing to understand about anemia of inflammation and the ultimate effect of bovine lactoferrin, which we'll discuss in a few minutes. You can go to our website at epiphanytherapeutics.com and read one of our blogs that is specific to the subject of anemia in the aging population. There's a lot of information there about the importance of anemia, the role that it plays in quality of life, and one of my biggest themes, the role that it plays in maintaining independent living. As we grow older and we experience a reduction in our hemoglobin due to the inflammatory processes, we have less energy. Having less energy reduces the amount of exercise that we get. It reduces our ability to care for ourselves. Ultimately, the ultimate negative consequence here is loss of independent living. Some of the data in our blog speaks to this directly. It's not my data, they're not my articles. National Institutes on Aging talk about the role of anemia in significant quality of life issues and how it changes our lives. These are things I think that require a lot of attention, and if we begin to understand more broadly that this is an anemia of inflammation, I think we will have done a great service, and those of us who are getting a little older will have a better quality of life to look forward to. The next patient population that I want to talk about in the context of anemia is those of us that have chronic diseases, particularly what we call autoimmune diseases, where there is some sort of persistent malfunction, misidentification in our immune system. No disease warrants any more attention than lupus. Lupus is an autoimmune disease. It affects predominantly women. Something between 90 and 95% of all lupus sufferers are women. And anemia is unfortunately a very common feature of lupus. Not all women with lupus, not all men with lupus are always anemic, but at any one moment in time, anemia will affect probably half of that population. Over a period of a year or 2 years, depending on the flares that individuals experience with their lupus, everyone will be anemic. Virtually everyone will be anemic. Now, how do we deal with this in a setting where inflammation is the disease? In lupus, the way we tend to view lupus is that its most profound expression is as a disease of antibody production, where we produce antibodies that attack our own tissue. But there's not just one element of immune system dysfunction at work. A number of individual pathways of the inflammatory system are affected, and these include elevation of interleukin-6, the same interleukin-6 I've talked about earlier today. In women with lupus, IL-6 is elevated. That may frequently correspond with disease flares, but not necessarily the case. So here we have an autoimmune disorder where the specific and direct consequences of the disease are already bad enough. And what happens to us? We are deprived of the energy-enabling factor in our blood that we call hemoglobin. And as a consequence, quality of life and ability to overcome the other negative aspects of the disease of lupus are diminished. Lupus is just one autoimmune disease, but because of the nature of it and because how specifically it is highly represented as an anemic population, we want to call that attention to it, and we're likely to be writing about lupus and anemia again in the very near future. Let's talk for a few minutes about the common treatments that we're familiar with in modern medicine for anemia. The first of those is supplemental iron, an oral iron supplement. Your doctor tells you to take iron if you're anemic. If you're pregnant and you're anemic, your obstetrician tells you to take iron. We believe that that's exactly the wrong solution, but iron is common. Iron has side effects. The side effects are the spike in inflammation that you saw in an earlier slide about interleukin-6, that's one. Two, iron leads to a general gastrointestinal uncomfort. It can cause constipation, it can cause nausea, a lot of conditions that we really don't want to have to put ourselves through in order to deal with anemia. But that's the most common thing that we have. Sometimes, particularly in diseases like chronic kidney disease, subjects will be given intravenous iron, so they get a direct bolus of iron in the blood. That's far less common outside of the world of kidney disease. Beyond iron, the other most common treatment for profound anemia is a drug that we all know as EPO. It stands for erythropoietin alpha. It's a recombinant protein that is given with an IV injection that sends the signal from the kidney to the bone marrow, right? So one of the premises is that erythropoiesis is interrupted if the signal doesn't go from the kidney, well, this is an artificial way of sending that signal. Erythropoietin is commonly used, very common in kidney disease, in cancer. It is a very expensive drug. In today's world, and it's 2018, EPO for anemia costs somewhere between $3,000 and $4,000 a month. The side effect that is principal that people report is a general lack of energy for a couple of days. Sometimes people just feel downright sick for 1, 2, 3 days. I have personal experience with that. My father had profound anemia, hemoglobin below 9, and was given EPO. I took him to the clinic when he got his EPO. And for the next 2 days, he was sick. He was already 92 years old, he was anemic, and he was sick. Not a good thing, but this is how we look to treat anemia in modern medicine. One of the other common methods for treating anemia, and this treatment is common in kidney disease and is less common in the others, but it's something you need to know about, and that's blood transfusions, where we take red blood cells from one living human being and put them into another living human being. It immediately increases your hemoglobin, so you get that benefit. But over time, you develop antibodies as a consequence of this, and that's not always a positive thing. There are risks associated with transfusion. It is becoming decreasingly common because of those risks and the fact that it isn't curative and doesn't solve the underlying condition. So in this video today, we've talked about some of the common conditions where anemia occurs. Pregnancy is a good example, anemia of the aging population, lupus, and other chronic diseases. And we've talked about what the common forms of treatment are for anemia in those diseases, the historical modern medicine approach to treating anemia. Now I'm going to talk about lactoferrin. I'm going to talk about lactoferrin, and I'm going to talk about our lactoferrin. This is a crass commercial moment, but let's get to the point about why bovine lactoferrin is an effective intervention in the treatment of anemia. Bovine means cow. So our lactoferrin is harvested from fresh cow's milk immediately after the fat is skimmed and the milk is pasteurized. It's one of between 400 and 600 proteins, enzymes, growth factors that are found in milk. All depends on who you want to talk to as to what the actual number is, but it's a very big number. We take one of those proteins and purify it to make it have the property necessary for you to get the benefit in the treatment of anemia. I want you to think for a moment about the data that we showed you from 2 clinical trials earlier in this video, particularly about 2 things. One, the increase in hemoglobin that is observed after a 30-day course of treatment. The other data point I want you to remember is interleukin-6, how it responds to bovine lactoferrin by being reduced, and how it responds to iron supplements by being increased. This points, again, to anemia of inflammation. Lactoferrin is highly effective at reducing that inflammatory response and enabling the body to produce hemoglobin. It doesn't cause the body to produce hemoglobin like EPO does. It enables the body to do what it should do when it's in a normal condition of homeostasis, when you're healthy. That's a remarkable thing. when you think about it in the presence of chronic disease. We're able to take someone with chronic disease and allow that portion of their vital life functions to function as normal. So what's different about Acacia Bovine Lactoferrin from the other lactoferrins that you can buy? It's quite simple. It's about purity. The least expensive way to make bovine lactoferrin is to extract it from cheese whey, right? A byproduct of the cheese manufacturing process. But what do we have there? We have, by necessity in making cheese, we have molds and fungi, we have bacteria. We create a soup of living organisms that ultimately produce the cheese that we enjoy. Well, that soup contains a substance that we know as endotoxin. That soup degrades the lactoferrin that's found in the cheese whey, and as a consequence, you don't get the efficacy from cheese whey that you would expect. This slide is a simple scientific tool that we use that is called gel electrophoresis, and what you see in the first column on the left is a representation of the protein lactoferrin when it is derived from milk. The other columns represent that same protein when it's derived from cheese whey. You can see that it's a mess. There are a lot of fragments. There are a lot of other substances in there that you really don't want in your body, and they all contribute to a reduction in the ability of the body to make use of the bovine lactoferrin to reduce inflammation and make hemoglobin. We're really proud of the process that we developed. We did a fabulous job, and unlike anyone else, we figured out the way to strip bacterial endotoxin off of lactoferrin. Endotoxin is a pro-inflammatory substance that we find on bacteria. Well, think about where milk is made. Milk is made basically in a bioreactor that happens to be the udder of a cow. There are bacteria in the udder of that cow. That cow may have mastitis. When that milk is extracted, much of the lactoferrin is saturated with endotoxin. It's a little bit wonky to say it, but we need to strip away that endotoxin, end up with a pure protein in order for you to be able to see the benefit that you want to see in trying to resolve your anemia. And in the case of our many customers who use Acacia Bovine Lactoferrin to treat and prevent their diverticulitis, the same feature is equally important. A couple of things that are really important to remember about bovine lactoferrin in general and Acacia purified bovine lactoferrin in particular. Two things. One, the capsules in a bottle of Acacia bovine lactoferrin contain 250 milligrams of lactoferrin. The women in the pregnancy-associated anemia studies, most of them received 200 milligrams a day. That's slightly less. Some of them received up to 400 milligrams, slightly more. There's no real dose response curve that's ever been developed around bovine lactoferrin. It will have to do with how much inflammation is in your body, how big is it in your body, how much blood is in your body. All of these variables are important to consider. So I'm going to tell you right now, we make no dosing recommendation, but we provide the product in 250 milligrams. I take 4 a day, a gram. Why? Because I do. Because I have for years and years. I have no adverse events related to it. My hemoglobin has been between 14.5 and 15, which is very good for the last 10 years, and I'm not going to change that. The other critically important thing to remember about Acacia, purified bovine lactoferrin, it's not a drug. none of the things that I've told you today have been reviewed by the FDA prior to my making those statements. I'm not trying to practice medicine on you. I'm trying to tell you about an alternative. Much of the data that you saw was presented to the FDA as they considered methods for treatment of pregnancy-associated anemia, but they didn't weigh in with an opinion. They didn't express an approval. So please keep that in mind. Thanks for your time today. Thanks for listening and watching this video. We appreciate it. It's an important tool for us so that we can kind of verbally tell you some of the things, give you some of the details that you can't always find in the written word. You're invited to go to our website, epiphanytherapeutics.com, where you'll find some articles on the topics we've covered. You'll find the scientific references from Professor Valenti linked in our website, and you'll find some testimonials from people other than me that use Acacia purified bovine lactoferrin for their own uses. And I always think it's better to hear from people other than me. So please go take a look. We're likely to do more of these video pieces to give you a more in-depth understanding of inflammation and disease. So keep your eyes open. Thank you again.